of the torso, so not the back, is that they're all attaching to the pelvis in some way, but the pelvis isn't fixed. Okay? So if the muscles of the leg aren't strong, they're going to screw up our trunk manual muscle test, and vice versa. Because we need muscles to hold the pelvis in place while we strength test the muscles of the torso. We are going to try to stabilize the pelvis as much as possible so that we can get a true manual muscle test grade of the torso. When we cover the hip next week, we'll actually talk about common compensations and how these tests might go awry if the muscle on the other side of the pelvis is weak. So when we look at the back, we're looking at the trunk extensors, we're looking at the hip extensors have to be strong to hold the pelvis in place. Okay? If we're looking at the trunk lateral flexors, we're looking at hip abductors and trunk lateral flexors. When we're looking at the abdominals, we're looking at the hip flexors. So we need the counterpoint muscle to hold the pelvis in place for us to have a good test. I want you to be aware of that now, and that's also why we're going to really stabilize the pelvis today. When we talk about the hip, again, we'll talk about those compensations. All right? So the first one I'm going to have you do is put your hands behind your head, and I'm going to hold your legs down, and what I want you to do is go ahead and lift your head and shoulders up off the table. Nice job. Hold it. You don't get to go back down. It's not 6 seconds yet. And relax.
Is that a 6-second hold?
It's a 6-second hold. This is not going to get a 5 through 0 grading system. You can see on the slide that the language is going to be normal, so that would be a 5 out of 5. But then you're going to talk about weakness, so slight, moderate, or marked. This is your perception. So 1, are they able to get fully off the table? And 2, are they able to hold it for 6 seconds? So if someone is not able to come up very far, they might have marked weakness. If they're able to come up, but they're not able to hold it, that might be moderate weakness. Okay? If they are able to go fully up and they're able to hold it for 4 or 5 seconds, but they start to kind of waver at 6, that might be slight weakness. Okay? But we're not going to use the standard 0 through 5 on that. Okay? So that's back extensors. Oh, this one's my favorite. I don't know why. So quadratus lumborum. You said you like quadratus lumborum. So this is your soccer muscle. Okay, so for those of you who play soccer, you'll have really strong quadratus lumborum. What I'm going to have you do is just rest your head. Yeah, there you go. So I'm going to test this side. So you're going to bring the leg out into slight abduction, into slight extension. And then what I want you to do, Sarah, is hike your hip up for me. There you go. Do you have it up? Yeah. Okay, hold it there. Don't let me pull it down. Yeah! That might be why I like it. And relax. Good.
Wait, what is this doing?
Sound effect.
Testing 12.
Oh.
Now,
Okay.
so now this one again, you're not going to give a manual muscle test grade. You are again going to say normal, slight, moderate, marked weakness. Okay, so you're not going to give it a 0 through 5. You are going to have them hold that for the 6 seconds.
How long do you pull then?
For 6 seconds.
You pull for 6 seconds.
No, that was more for effect. So, because you were sliding, you don't want people to hold on to the table, so you want to have a little bit more friction than on the sheet. Okay? Alright, lateral flexors. This is the one that if our situation was reversed, I'd make Kevin turn the video off. So I'm going to have you lie on your side. I'm going to have you lie on your other side. I was not clear. Okay. Okay. So I'm going to have you go ahead and bend your legs. Both. There you go. Good. So just want to have a nice stable base. Now for this one, what you're going to do is it's very important that the ear, shoulder, and hip are all in line. So I'm actually going to move your head back just a little bit. And I'm going to want you to come straight up off the table without rolling forward or without rolling back. Okay? And what we're going to do is we're going to tuck this arm across your chest, and then this arm you're going to lead and just go down this way. Okay? I'm going to be right here, and I'm going to be holding your pelvis so that it doesn't slide on you. Okay? Go ahead and come on up. And relax. So Sarah's form was really nice. Okay? She didn't rotate forward, she didn't rotate back. She came up nice and straight. Now, how you grade this one is on the slide, and you're looking at how far they're able to come up. So to get a 5 out of 5, you need to lift the shoulders up 4 inches. It didn't look to me like she lifted up 4 inches. Okay? To get a 4 out of 5, you have to lift 2 to 4 inches from the table. I would have said she was in that range, so I would have given her her trunk lateral flexors a 4 out of 5. A 3 would be able to get the shoulder off the table, but it doesn't come up 2 inches. Okay? A 3 minus is that you're getting, can you lie back on your side for me? And fold that arm across your chest. There you go. So she's getting approximation of her shoulder and her hip, but her shoulder's not clearing the table. Okay? But you're seeing those approximate one another. Okay?
I guess we're gonna get into it. For gravity eliminated, do you have them lay on their stomach or back?
A back.
Okay.
Back. Okay. But gravity eliminated, we're not going to get. If you want to go into gravity eliminated, I would go supine, but you're not going to do that for these tests because you're going to just look at whether or not they're able to get that approximation to get those scores of less than a 3. Okay?
She said if she couldn't get her shoulder off, that was a 2.
Yeah, it's all on the slide.
This is primarily obliques.
Okay? Yeah. And this is mixing internal and external.
Yeah.
Okay? All right. So next slide is the compensations. So these are the things you're going to be looking for that you want to correct. So if she did these, I would have her redo them and I would really work on her form. So she can't forward twist her torso. I don't want her to backward twist her torso. I don't want her low back to get into hyperextension as she comes up. Okay? And then the last point is what we talked about before. I'm really trying to stabilize her pelvis, but if she has weak abductors, it could affect this test. Okay, and we'll talk more about that next. Are we good with that test? This is the one that people are going to be fairly weak on, and it's going to be very important to look for compensations.
Do you approximate the distance to for whatever inches, or do you actually have someone try to measure them while they're in there?
No, you're approximating.
And that's the downward
acromion
okay.
to the table. Okay? All right, oblique trunk flexors. I'm going to have you lay on your back. So this is the only manual muscle test ever that you're actually going to put the patient in their test position. Okay? So I'm going to have you, actually, let's have you put your hands behind your head. And then I'm going to lift you up without pulling your hair. Sorry. Okay. Oh my God, you have to help me up. Okay, and then we're going to turn you. Okay, can you hold it there?
No, maybe.
Okay, hold it there. 4. You can do it. 5.
Through the burr.
5.5. 5 and 3/4. I'm kidding. Go ahead. So you have to help put them in that position. You have them at about a 45-degree angle, and then you rotate their shoulders. But again, you're putting them in that position. This is another goofy. I call these the Macarena grading. Does anyone remember Macarena?
Yes.
Okay. All right. So 5 is here. 4 is here. 3 is here. Okay? So, so if someone can't hold that position with their hands behind their back, you're going to put them in that position with their hands across their chest and then ask them to hold it. Okay? If they can't do that, you're going to put them in the position with their arms out and see if they can hold it.
Are the legs stabilized on this one?
No, they don't need to be. So 5, 4, 3.
Should the legs leave the table?
Oh, it says stabilize on this.
It does say stabilize. Okay, then you should stabilize.
No.
That's a good question.
Hers were coming up.
Yeah.
So I wasn't.
No, that's
So,
a good question.
The problem with
Isaac,
stabilizing for the abdominals is as soon as you stabilize, they can use their hip flexors to hold. So generally for abdominals, you don't want to stabilize legs because then they can use their legs instead of their abdominal muscles. So you want to be careful about how much stabilization you give.
So if hers were coming off like they were, is that good or bad?
She did great. So
Okay.
I would give her a 5 out of 5. Okay? No, go back to the grading, please. So we talked about 5, 4, and 3 plus, sorry. So this is 3 plus. 3 is going to be in the position of arms out, because she's able to clear her scapulae. She's able to keep her scapulae off the table. Okay? 3 minus is going to be, again, that you're getting that approximation in the diagonal, but she's not able to clear her scapulae. And 2 would be that there's less approximation, and 1 would be that you can palpate the contraction. All right? And obviously you would test both sides. Okay?
When it says with resistance in the slides, is that just the gravity, the angle that we're putting them at?
Yeah. Yeah. All right. How many is that we just covered? 3 or 4? 4? Do you want me to go ahead and show you, or do you want to do those 4?
No, let's practice first.
Yeah.
Yeah.
Okay. Okay, so let's practice those 4.
All right, let's go.